This is a continuation of my presentation on using the ultrasonic tips instead of Munspurs. When you go into some of these places that are filled with composite, um, trying to do this with the Munspur is just really hard because this is done at high magnification and the handpiece blocks really what you need to see. So you have to do it at lower magnification and you miss all of the details. When we do this in our office, we do this under the highest possible magnification because it's a very discreet, careful procedure. I'm showing this on an extracted tooth that has had composite placed down into the pulp chamber so you can see. This is the UT4 90 degree, and what I'm going to do, if you dry the canal out or the pulp chamber out with 200 proof alcohol, you can actually see the texture of the composite and distinguish it very easily from dentin. So after you've dried it out and you go in with your CT4D tip, and put it up on the highest magnification, you can see you can be extremely precise with the removal of this composite and not really even touch any of the dentin. This is done under high magnification with the assistant with the Strapco blowing the dust away. And what you need to do is learn how to adjust the ultrasonic power settings on your cart. And we do anything from 50% to 100% on the tips, depending on how rapidly I want to remove the composite. So in this example, the tip is set at about 60%. And you can see you have very, very good visual and instrument control over the removal of that composite. So we do this with the UT4 tips, with the ball diamond and Pear diamond. This is the ball diamond. Now the power settings here are at about 70%, and you get this shaving motion that you can see very, very clearly what you're removing and avoiding the dentinal wall. So the chance of perforation doing it this way is almost zero. If you put it up on high magnification, you can see very, very clearly that you're just removing composite and not even touching the dentin. So this is how we've done it in our office for many years. And the trick really is learning how to do it at very high magnification and adjusting the power settings. Now this is the Pear diamond, which is even larger and it's a little more active. So in this case, there's just a tremendous amount of composite resin and I want to remove it a little faster. And you can see how it just shaves the composite away, and I don't touch really any of the dentin. The other thing about the tips that is nice is that you have tremendous feel with these tips in a way that you don't with the Munspur because of the vibration of the handpiece. So you have both greater feel and greater visibility doing it this way. There you can see I'm removing all of the composite resin that's been packed down on the furcal floor and doing it very confidently, very low stress procedure. And you can see how well you can see while you're doing this. Now this is a setting with the ball at about 70%. And you rotate this you do it dry and you do it wet. And as most of you know, our tips don't have a very minimal breakage frequency. So this is the Pear diamond. And a lot of times I'll do that just to clean things up. So I turn the water on and your touch with these, your feel is very, very good. You can actually feel the difference between the composite and the dentin. It's possible to tactilely feel that difference. Now you can see it's all cleaned up. And now I'll go in with the tips or a smaller ball diamond, and I'll remove the rest of the composite. And here, typically with the burr, you're just worried about perforating through the floor or going someplace where you don't really want to be. So you can see how that Pear diamond really cleans everything up. So you're using these tips with water, without water, and you don't really have to worry about the breakage with these tips, unlike some of the other brands. So now you can see there's been some colored composite that's been placed underneath. So now I'm right on top of the Ferkel floor, and I go in with the Pear diamond, and I can really selectively remove that colored composite very, very easily and not really even touch the dentin on the Ferkel floor. Because I have such good visibility there compared to the Muntz. If I go in there with the Muntz burr, I'm flying blind. I can't see anything. And I can't feel very much because of the rotation of the burr in the handpiece. So I thought this might be helpful for some of you that maybe aren't familiar with this. Going now in with the CT4D, and here I'll turn the power down a little bit because I want to have a very, very precise removal of that colored composite. So sometimes I'll turn this down to like 50%, and it's extremely precise when you use it at these lower powers, and it just basically shaves away the composite, and you have just immaculate control over what you're doing. Here you can see I've removed most of the composite, and I haven't even touched the dentin. The dentin hasn't even been touched with the tip. Now I go in and I remove the remaining thing, and I'm going to put this up on high mag and maybe a little slow motion here, and you'll get a sense for how this is done actually in the mouth. So I hope this helps some of you understand who are maybe doing this a little bit differently with more stress and more danger involved. So when we're in cases like this, it's a very low stressful environment because you have such precise control over what you're doing. So learn how to adjust the power settings on the ultrasonic and experiment around with these various tips, and pretty soon you'll see just really how much better they are when you're in these high risk areas.